근데 이거가 조그만한 그거 이가 안 돼. 그 너무 조금 봐주는 거.
Did you start videotaping?
Yeah, we started already, so.
And I got to.
As you know, we've increased our membership quite a bit, and it's evident by the hard work of all our board members. And I think we've been growing almost doubling every year, so we have lots to go and a bright future. I'm very happy to welcome you to this conference, and I'm very, very honored to welcome our Dean, Dr. Mary
I
Boland.
also need to acknowledge Jillian. She received an award this morning at the Pacific Institute of Nursing as the nurse researcher for the F1 Institute. And I think that's fabulous. She's done a lot of work in addition to her organizational activities in terms of growing research. So you get the sense we have a little bit of a mutual admiration society.
This afternoon, we'll be having our keynote address by Dr. Marjorie Kagawa-Singer.
But because the numbers are so small in each region, the numbers that actually pick up APIs becomes too small to analyze statistically, and then we get dropped from the analysis or the report altogether.
Think about your curriculum. How often do we teach students when they talk about mental health, they have to think about work, the job, how a job can affect your mental health. Vice versa, when we talk about occupational health, we probably don't talk about mental health.
Their stated successful surviving of victims.
That motivated the parent generation. That's what motivated our generation. But in our children generation who are growing up in individualistic society, that's not what motivates them.
Yesterday morning, domestic violence slains on the rise despite our efforts. And so we feel that what we are involved in is very pertinent to the health of women in Hawaii.
Asian American community. I'm just going to let her come up and take it away. Thanks you so much, Marilyn, for coming.
I can understand what it is and how it will benefit the outcomes. So you have to know, what are people looking at? So what's the National Quality Forum doing?
Then 61% of uninsured people had income under $50,000, and 30.5 million has under $25,000.
Our partners and the American Pacific Nurse Leaders Council will be speaking a little bit about how we can make connections. And Captain Kathy Wassam, who's the U.S. Public Health Services Commission Corps Senior Public Health Advisor, you should all know her,
is going to make the introduction and connections.
And through my work here in Hawaii and the Pacific, I've had the opportunity to work with we call it APNLC. And, you know, when I heard about APINA, and I have to say, I was like Marilyn, I was Googling a couple of years ago to look at, you know, connections for Asian Pacific Islander nurses.
Thank you for the opportunity. I met Kathy in 2006 or 7 when Hawaii hosted the APNLC.
In our study, we asked patients several questions regarding their self-management behavior. But the literature on the Chinese Americans with the diabetes and the self-management behavior is
statewide. And the Japanese women includes in the sample. And I was so surprised, and at that time I came to Hawaii, and I was involved in early discharge.
In another example, a Healthy People goal is for early prenatal care access. Care started before the end of the first trimester. The Healthy People goal is no less than 90% of women start their care early.
Berkeley Valley had started their program for the elderly, and they're located in Honolulu also. It's another community health center where their program for the elderly is so big.